So NIPT stands for Non-Invasive Prenatal Testing. It is a risk assessment test that gives a high or low risk result for 5 of the most common chromosomal abnormalities. It involves an ultrasound exam and a maternal blood sample. It can be done from 9 weeks gestation onwards at any time throughout the pregnancy. It is an opt-in test, therefore it's not part of routine antenatal care, and it is available to everyone. An information leaflet will be given at the booking visit, whereby you can go ahead and book a test in the fetal assessment or unit on the second floor, or you can book in a test with the RCSI Rotunda also. The results are sent to the USA for testing, and they're back with us in 10 to 12 days, so a result would be expected within 2 weeks. If the results are low risk, they are posted out to you, and you don't need to take any further action. If you get a no result or a high risk result, one of our fetal medicine midwife counsellors will give you a call explaining the result and inviting you back in to the fetal assessment unit for further testing and to discuss care. It is worth noting that 98% of people who have an NIPT get a very reassuring low risk result. The maternal blood sample contains fetal DNA, which is passed from the placenta into the maternal blood supply. This cell-free fetal DNA is then examined in a laboratory. The DNA is within the chromosomes. We all have 46 chromosomes, or 23 pairs, and an XX for female and an XY for a male. If there is an extra chromosome, this is called a trisomy. So for example, Down syndrome has an extra chromosome 21, it's called trisomy 21. Sometimes there's a whole extra set of chromosomes. This is called triploidy. So NIPT gives a result, high or low risk, on the 5 most common chromosomal abnormalities. These are trisomy 21, which is Down syndrome, trisomy 13, which is Patau syndrome, trisomy 18, which is Edwards syndrome, triploidy, which is an extra set copy of all chromosomes, any X or Y linked disorders, or Turner syndrome, which is only found in female fetuses, which is 1X instead of 2. Some of these conditions are life-limiting conditions and some are not. If you are given a high-risk result, you will be contacted by our fetal medicine midwife. You'll be invited at the next available appointment to come and meet one of our obstetric consultants, who will then discuss further diagnostic tests with you and a care plan. So we will endeavour to look after you throughout your pregnancy with whatever care plan you wish to choose under Irish legislation. So the test claims an accuracy of 99% in Down syndrome, for example. It is a very highly sensitive and specific test. So if you get a low risk result, they are 99% sure they are correct. If you get a high risk result, they are also 99% sure they are correct. But with all high risk results, we endeavour to make sure that it is correct by offering invasive tests like amniocentesis or CVS. So the test is available to have done anytime from 9 weeks gestation onwards. You will be informed about the test and given a leaflet about it at the booking visit, which is 11 to 14 weeks, but you may wish to access the test earlier than this. If you phone the fetal medicine unit, ultrasound department, or the RCSI Rotunda, an appointment can be given to you then. The test costs €450 here in the Rotunda Hospital. Most of that cost goes to the company and in transporting the samples. We're unclear about that here for the simple reason that there are very many healthcare providers with insurance, and we're not sure exactly which test they cover. What we can do is issue a receipt with the NIPT and give it to the patient so they can discuss with their own healthcare insurer and see which parts of the test are covered.